Hey everyone, welcome back to Staying Connected, a podcast where I talk to other people about their stories with vascular Ehlers-Danlos syndrome, or VEDS, which I also have. This is Katie, your host, and today I have Daniel with us who's going to tell us his story with VEDS. Hey Daniel.
Hey Katie, how are you?
Good, how are you doing?
Good, good.
Good. I'm so glad that you're sharing your story. I know that you were diagnosed not that long ago. So big kudos to you for getting out there and connecting with people so fast.
Thank you. Anything I could do to help?
Yeah, so tell me about yourself. What do you do?
I manage an IT department for a busy Bergen County hospital. I've been doing that I've been there for about 8 years, and then before that, I was in another hospital doing their IT department. Pretty much my entire life, I've been working in IT and healthcare.
So when were you diagnosed with VEDS? How did that happen?
I was diagnosed around January. However, I had a pretty serious event in October of last year. I had a abdominal aortic aneurysm, fairly large saccular aneurysm. And during that finding, we found two iliac uh, aneurysms, and during the repair, we accidentally caused a additional aneurysm that needed to be embolized in my leg.
How did they find that AAA?
I woke up in the middle of the night. I don't want to say severe pain, very bad pain, annoying pain. Almost felt like food poisoning. I tried to sleep it off. Being lucky enough to work at a hospital, I figured, you know what, I'm going to go into work a couple hours early. They'll give me some anti-nausea medicine. I was nauseous and throwing up as well, and said, I'll go into work a little early. They'll give me some pain medicine, some anti-nausea medicine, and I'll start my day. Got to the ER around 5 o'clock in the morning. About an hour and a half in, they're like, all right, Mr. Sperry, we'll get you out of here soon. It's probably just some food poisoning. Your pain went away when we gave you the medicine. And then about another 15 minutes later, a nurse came in and started putting leads on me and said the vascular surgeon saw something he didn't like. He'll be in to explain in a minute. And that's when he came in and let me know that they found an aneurysm on my CAT scan. And we started talking about all the options.
Oh, wow. So how did
Yeah,
how did they explain it to you? I mean, did you understand what an aneurysm was before that, working in
I
healthcare?
did. I did a little bit. And when we start talking about my family, I've learned a little bit about aneurysms, but my vascular surgeon was awesome, and he you know he realized, hey, maybe I can speak guy lingo, and he's like, when you have a tire and you have a sidewall, and he's like, your sidewall is blown out, and the reason why I kind of had emergency surgery was because it was saccular. So he explained to me, because it's just the side and it's not on both sides, it's just the one side that it's much weaker. Just like if you were driving around with a bubble in your tire, it's
Hmm.
eventually going to blow out and you need to get it fixed. Um, he sat down, he explained it with my wife and I very well. I'm also fortunate enough to have a brother who's been working in healthcare and a very close friend who's a general surgeon, and I was able to call them, and obviously without knowing all the details, my brother's friend was very concerned about why I'm 39, 38 at the time, why a 38-year-old would need surgery for an AAA. That's very unlikely. And because I was only given out, the non-clinical stuff, he's like, that's not even big enough to recommend surgery. After he spoke to my surgeon, he was like, well, it's saccular. He's 38. This shouldn't be here. They both agreed that surgery was probably the best option.
So you went through the surgery, was it that day or was it later that week?
Oh yeah, no. The timeline was I was in the hospital. Was in the ER about 5. Found out about 8 o'clock, 8:30 that I had the aneurysm, and was in the OR by 1.
Wow. So you said
Yeah.
during that procedure, something ruptured?
Well, so it didn't rupture. So what happened was, so this was supposed to be an hour and a half surgery. I was sitting. We got in. I probably started at around 2. It was supposed to be an hour and a half. It wound up being a 9.5 hour procedure.
Ooh.
because what had happened was when they were cleaning out, when they were repairing the iliac, and this might not be 100%, but it's going to be, I think, close enough. When they were repairing the iliac, a blood clot broke loose into the leg. And then not knowing that I was VEDS and understanding that there was something wrong because I had these aneurysms, at this point they didn't really understand how fragile the arteries were. So when they put the balloon down the artery to try to clear the blood clot, every time they touched the side of the artery, it would kind of balloon out. So they were spent all this time trying to repair it. And they thought they had repaired it. However, my pulse on my left leg was a lot weaker than my right leg. So obviously I was admitted to ICU that night when we watched it. Everything seemed to be okay. I was home, and then a couple days later, I can't remember if it was a couple days or maybe a week, I got this really bad pain in my calf, and I came out of the bathroom with this really bad pain, and my wife was like, "What's wrong with you?" And I'm like, "What do you mean?" She goes, "You just don't look right." So I guess I'd gotten really clammy and pale, and my eyes just looked a little confused as I came out. I'm like, "I just have a little pain. I'm okay." And as I sat there, my toes started to get tingly. It just so happened to be the same day I was supposed to be meeting with my cardiologist from a post-op follow-up. So I called them and I said, "Look, should I come into you guys because you're urgent care? Should I just go right to the ER?" They said, "Just go to the ER. It's probably nothing." But then they did a CAT scan on my leg, and when they did the CAT scan on my leg, they saw a very large aneurysm. And at that point, my vascular surgeon came back in and was like, "We're just going to embolize this because it's not that important, and there's no reason to go back in to look at it and try to repair it." So it was about a week later that I went back in for the embolization.
So did he suspect something was wrong at that point?
He did. He suspected something was wrong after the 9 hours. He wasn't sure what. I don't have most of the signs. So what we wound up doing was he's like, "Look, I have no idea." He's like, "But we know it's not Marfan's." And then when I went to see the geneticist, even they were like, they thought maybe Louis Dietz because they're like, I'm not double jointed, my skin's not translucent, I don't really have any of the features. If anything, I'm stiffer than anyone I know. I played football and wrestled my entire life. There was no signs whatsoever until I've done, I look back in history and we can talk about that. But from a visual standpoint, there was no signs at all that I had VEDS. And even when I started doing my research on genetic disorders, I even said, maybe it's VEDS. They're like, "I don't think so. You don't really have any of the system, any of the other indicators." But it turned out that it did.
So then he proceeded to do a genetic panel then?
Yeah. So the cardiologist did a genetic panel, and that's when I got the results about a month later.
How did that feel?
Scary. It's scary, but at the time they made me feel comfortable. The result aspect, I don't really like to say anything bad about any company, but they did not handle giving me my results in a very good manner. Apparently they were going through a new EMR replacement, and I just happened to be one of the last patients that on the new system, and I got lost in the shuffle. And pretty much the way I found out that I had vascular Ehlers-Danlos was about a 30-second call before wrestling practice, because my son wrestled and I was a coach, was, "Just so you know, your genetic results came back. You do have vascular Ehlers-Danlos, and we're going to be sending you a packet in the mail." And that was pretty much it. And I said, well, I got a couple questions. I did do some research. The first thing you read is about life expectancy, and you Google vascular Ehlers-Danlos, and the first article that comes up is when a sneeze can kill you. Can I talk to you a couple minutes? Because that's pretty threatening. She's like, yeah, it seems like you did. She's like, I would try to stay off the internet. We'll get you scheduled for a follow up, and once you get the pamphlet, the packet. She's like, because the internet always makes things sound a little bit more dangerous than they are. She's like, this is a very serious condition, but just don't try not to use the internet as your research. And I was like, okay. So I waited and I waited and I waited for the packet, and it never came. So that was in January. So beginning of February, I called back and said, hey, look, I need this packet. I started doing all the research. I wanted to be a part of the support groups that you and I are part of. I was like, I need the results so I can join these groups and join these support groups. Like, oh, I'm so sorry. We'll send it out to you. So never sent that out again. And then on February 14th, I'm sitting with my wife about 9:30 at night, and I get a call from New York City, and I don't know anybody in New York. So I'm like, all right, 212, let me answer this. Like, it's either someone trying to sell me warranty for my car or it's important. I answer it, and they're like, hey, just wanted to let you know that your results came back in and that you do have vascular Ehlers-Danlos. I'm like, well, I know this. I knew this a month ago. I just need the packet. So they're like, oh, we're so sorry. You must have got lost in the thing. We'll let the doctor know, and we'll get it all sorted out. And then about another 4 or 5 days later, the doctor called me saying, oh, I heard that you didn't get your results back. Just so you know, you have vascular. So I'm like, you know what? I appreciate everything. I'm like, please, I don't need the consult or the conversation anymore. Just email me my results so I can. So they finally emailed me all the results. So I really haven't had a conversation with the geneticist about it. However, I do have an appointment for I think next week or the week after. I'm going to be seeing I made an appointment with the geneticist at Mount Sinai, New York, so that we can work with them, so I can actually get a geneticist who's engaged on my side. Wow.
So you haven't had that conversation?
Nope, I haven't. So I'm still living in a bubble of everything's going to be okay anyway.
Wow, that's crazy. Do you have so I think you mentioned with your aneurysm and with this diagnosis of VEDS that, looking back, you can see some things even though you don't have any of the, like, quote unquote outward signs, like the translucent skin and things like that. What are those things?
So the one that comes to mind right away is when I was a kid playing at the playground. We'd be on the monkey bars, we'd be on something high, and I'd jump off. And then all of a sudden I'd get like a little bit of a pain and my foot would just start itching. And I would get what I called popping a vein. It would just, the vein would just swell up, become very dark. Mm-hmm. It would last for, 10, 15, 20 minutes, and it would go away. And people thought I was crazy when I'd say this. And I'm like, why am I crazy? And I'm like, that doesn't happen. I'm like, no, you just don't play hard enough. I'm like, if you did what I did, then I'm sure you'd have these things too. Never thought of it. Second thing is I'm reading, and I used to fall asleep with my eyes open and scare the whole house. That they thought I was dead, and I'd be sleeping peacefully, and they'd scream and wake me up. Other thing is now I'm starting to think, well, maybe I wasn't the toughest kid on the block, and maybe all of the stitches and all of the cuts that I had from doing all the awesome stunts on my bike, maybe everybody else just fell and was fine. And maybe when everybody thought I was awesome because I'd be gushing blood from everywhere, that I was the toughest kid in the neighborhood. And maybe maybe I wasn't. Maybe my skin was just a little weaker than everybody else's. But those are really the main things that I've noticed since I've been, since I know the signs now. It was more just simple little things,
like little injuries and
just little injuries.
Yeah, I can relate to that. I have scars like all over my body from random things that, at the time I was like, well, this is normal for me, or I'm just a little too rough on my body. But, looking back, the same as you, is like, oh, maybe my skin was just too fragile, and that wouldn't have happened.
Yeah, at one point my mom had gotten questioned by Child Protective Services for the amount of times we were in the ER from stitches, or I tore my ACL, and I tore my ACL playing basketball. So I think that would have happened to anybody else, but now, now those are things that I question. Mm-hmm. I know the breaking of the bones was normal, but we were in the emergency room so many times with just, injuries that she did get questioned once by.
So does anybody else in your family have this that you think?
So after I got diagnosed, my brother did get scanned, and he has some things going on that indicated that he probably has it as well. And looking back, we're fairly confident that my father and his brother and his sister and probably my grandfather had it. My aunt had a stroke when she was in her 30s. But my aunt was a smoker and on birth control. So they attributed her smoking, her stroke to her smoking and birth control. And they just let it go. And so her stroke was severe enough that she was in a wheelchair and never really gained her speech. She could talk, but she always had she never got her side of her face was paralyzed her entire life since she was 30. So when she had, I forget where she had an aneurysm that finally, when she passed, but they just attributed it to her being in a wheelchair, having the stroke. They never really dug any deeper into the fact that, that it was just the time. And then my uncle, he died of a aortic aneurysm. He was already in the hospital at the time, and unfortunately, he let drugs control his life, and he used cocaine a lot, and they just contributed his issues to, the effects of drug use, and never really researched it further. He just was in the hospital, and I'm assuming was on a lot of blood thinners because he had just had I think, heart attack or something, and he just, passed. And then my dad and I are very similar in the aspect of he started having chest pains, but more like heart attack chest pains. So going back again before I had my aortic aneurysm, about 6 months before that, I was admitted to the hospital overnight because I had one enzyme that was elevated. I was having chest pain. So they observed me for a heart attack. They ruled that I didn't have a heart attack, but because that one enzyme was 0.001 over the threshold, they admitted me. And the same thing kind of happened to my dad, where I had to get him. He had he had a whole bunch of tests done. He was getting heartburn, and he was taking antacids. A little bit after that, he had gotten into a head-on car accident, and died. So the police, which I argue to this day, ruled it as he fell asleep because he drove from the Poconos to the shore, back to the Poconos, back to the shore in one day, and they said that would make anybody tired, and he fell asleep. It happened at 8 o'clock at night, and my dad was a DOT, one of the heads of the Department of Transportation. So literally, we live in New Jersey. We can have snowstorms that keep these guys up 4 or 5 days plowing. So he didn't fall asleep driving. So I figured it was a heart attack. At first, I figured he was driving, had a heart attack. And but now looking back on things, I'm fairly confident he probably had a rupture while he was driving. They were all in their 50s, but my grandfather, however, I think he was in his late 70s.
Oh, wow.
Early 80s, and he was healthy as could be up until he, about a year before he died, he just started having a lot of strokes. And then at one day he had 4 or 5 strokes in a day. All minor strokes, obviously, you would know them, but it got to a point where he'd wake up and he'd have a stroke. So I'm fairly confident. I think my grandmother, as sad as this is, just died of being heartbroken. She was the last one. You lost 2 kids and your husband, and my dad unfortunately had to put her in a home because he just couldn't take care of her anymore. And I think she just finally decided to go. So I'm fairly confident this comes from at least from my lineage, my grandfather.
Wow.
And then my other uncle, who's still surviving, he was probably we've always joked because he was homeless at one point, was an alcoholic, did a lot of drugs, and we always joked that he must have pickled himself because how did he outlive the 3 other siblings that were relatively healthy and weren't homeless, and so we just assumed that he pickled himself and was going to live forever. But now we're probably thinking, well, he probably doesn't have VEDS while the other 3 did, and that's probably the ultimate.
So how has this changed your daily life?
So a lot of people are probably going to hate me when I say this. It really hasn't. What it has done is it has definitely given me more anxiety. It has definitely made me hyper aware of my pains inside my body. Um, but it doesn't. It's changed my wife a little bit where she doesn't let me do stupid things.
Mm-hmm.
Really stupid things because I used to do really stupid things. Um, like I once blew up a blow-up pool. I bought a blow-up pool so I can jump off the deck because my friend and I thought it would be fun. Um, but what it has done is it's made me hyper aware and hyper anxious. Like when I have a gas pain, it's now I'm deciding whether I'm going to the ER or I'm going to excuse myself into another room. And and then that weighs on me. Like that can ruin a day, right? One bad pain can ruin a day because I just sit there and it's on my mind for the rest of the day.
Mm-hmm.
But then I can have great days like yesterday where, again, I do things that may anger people and probably anger doctors, but it was beautiful out. There was a lot of boats on the water, so I grabbed the jet ski and went out on the jet ski and started jumping some wakes.
Mm-hmm.
So it's not. I haven't let it from doing things. I haven't let this stop me from doing most things. As soon as I got my results back, obviously I pulled my son out of wrestling. It's probably going to impact him a little bit more than it's going to impact me. It's not like the Tim McGraw song, right? It's not like I'm going to go start doing skydiving and I'm going to start doing all of these crazy things because I don't know what the future's like. But my wife and I, we're in agreement and we're in understanding that if life is like a video game, after my event, on the bonus level, meaning I'm not going to do anything stupid to end it, but we know that the bonus level can end at any time, and there's really no goal or objective, and just not let it destroy us, but make sure it doesn't end early either.
Mm-hmm. Do you plan on getting your son tested? Do you suspect that he has it?
We do. So I suspect that he has it only because he has the exact same features my wife has. If you were to look at myself or my wife, you'd be like, oh, my wife's definitely the one with VEDS. She has translucent skin. She bruises easily. So my son has those features. And it that's the other thing, I guess, that really bothers me. Like, especially when I wear my sunglasses. I don't know why. I guess they just illuminate the veins better. But like we'll be outside and my son will have a shirt off and he'll be playing, and then I'll just look at him and I could just see every single vein in his stomach and his chest. And then I'm like, oh man, and then that throws me off for a little bit. But my only relief right now is that, well, my wife has that as well. And just because you have translucent skin doesn't mean you have VEDS. It's just a sign that you could possibly have VEDS. We are going to get him tested. I'm going to meet with this geneticist first, and then we're going to plan all that. She's going to send us home a saliva kit. Whether or not we completely change everything he does is still up for question. I mean, obviously, we want him to live a life. Luckily, he wrestled because of me, and he didn't want to wrestle. And I believe he played football because of me. He doesn't really like football. But there are certain things he wants to do. Like he wants to play basketball. He wants to play baseball. And I don't know if I would pull him out of every single sport because there's a possibility that a ball might hit him in the chest, or because VEDS or not, you have these possibilities. Right? There's been people that have gotten hit in the chest with a ball at the time their heart was beating and, instantly died, and that's, one of those things. So it's going to be one of those things where I don't know, I guess, until I know, which may be the reason why it's been this long that we've waited, which may not necessarily be such a great thing to admit, but I'm one of those people that if you can't enjoy, because there's plenty of things to do to enjoy life, but my mom tried to put me in a bubble when I was a kid, and it was not fun for me, and it was not a happy thing until I got out of that bubble. And my entire existence right now is to make sure my son is happy, and
Mm-hmm.
so it's going to be difficult. It's going to be tough.
And you're still kind of in this space where you haven't met with a geneticist yet. You haven't had those deep conversations about what it means and what, you know, the possibilities are and what to look out for other than what you've done research on, right?
Yep. Yeah,
So
exactly.
you're just kind of in this like space of uncertainty, really.
Yep.
Wow. Is there anything that
Um,
you would want somebody to know who's newly diagnosed? I mean, you're pretty newly diagnosed yourself. Or anything that you've experienced that you want people who haven't experienced this to know?
um, it's it's scary. It's very scary. What I'm going to say is it's probably been, as my wife is extremely strong, and it's probably been harder on my wife than it's been on me. But it's hard for me because I read and I'm looking at all of the Facebook stuff and I'm looking at all of the people, and in all honesty, I don't really relate. I had one, we'll call it one event because they're all kind of tied. I had one event and it was successfully repaired.
Mm-hmm.
Um, I don't I haven't experienced the having to, have the multiple surgeries, or, having the dissections. And I think right now for me it's a little bit easier not having all of that. And not that I wish or want anything else to happen, but I don't know if I'm going to understand the life-changing aspect of this until those things
Mm-hmm.
possibly happen. If they do, like I said, the pain's scary. The experience that my wife has to go through is scary. And I would say for me, I just need to understand that my wife is going through the same thing that I'm going through. And when she tells me not to lift up that case of soda, she's doing it because she cares. um, and sometimes you just have to accept the fact that you're not who you were before you found out that you have VEDS, and you just have to accept that you're going to have to do things for your family that you might not want to do or admit that you have to do. And when there are the random pains, you have to make sure that you do what you feel comfortable doing. If breathing and trying to wait it out a couple minutes makes you feel comfortable, or if getting in a car or calling an ambulance and getting you right to the hospital makes you feel comfortable, don't worry about what other people think or what the situation is. Just do what you have to do, because we're unique, and um, people are there to help us.
Mm-hmm. Thank you so much for sharing your story,
You're welcome.
especially so soon. I'm really impressed with I just can't get over the fact that you just found out this year. So
I
it's big.
well, it is, but I think another thing is that I think if there was more awareness, we'd find out more people are living with us. And I think if there was more awareness, people would doctors would make better informed decisions. A good example is thanks to COVID, one good thing happened to COVID is I can get a telehealth appointment. I got a telehealth appointment with Dr. Shalhoub,
Nice.
which is awesome, because I've learned, hey, the worst thing you could do for an abdominal aortic aneurysm is to put a stent in. Well, my doctor didn't know that because he didn't know I had VEDS. So right now, what I have in my aorta is a stent.
Mm-hmm.
Um, so I'm living with that. Like I don't know what I should do. Should I go in for proactive surgery and get the stent, bypassed, or should I just live with it and monitor it? So I think if there was more awareness, I think doctors would be able to make more informed decisions as well.
Absolutely. And that's a really, really great point, and something that I've, dedicated a couple years too now, and I love Dr. Shalhoub, and I'm sure that you will too. And it's really good that you're able to get a telemedicine appointment out of everything.
Yeah.
It's really great. She has been a champion for our community. We have several physicians who have really been champions, and she's a big one. So tell her I said hi.
I will.
Thank you again so much, Daniel, for sharing your story.
You're welcome. Thank you.
And thank you, everybody, for listening. This was Staying Connected. And this was Daniel sharing his story with VEDS. He was just diagnosed in January. So kudos to Daniel. And thank you, everybody, for listening. There'll be another episode at the end of every month, the last Sunday of the month. So take care, and we'll see you soon.